Hi, everybody. Welcome back to Service and Sacrifice for this week, April the 10th. Thanks for joining us here on WTEN Plus. I am joined, as always, by these fine gentlemen, Dom Dominguez, Emil Baker.
Hey.
Welcome, gentlemen. How are we feeling?
Feeling great.
Yeah, enjoying spring.
I wish we had a little bit more sun so far this spring, but we're getting there. Send any complaints to your local meteorologist here at News 10 ABC. As we like to do at the top of each show, address some sort of hot topics surrounding the VA and our veterans. Dom, I came across this right through the national VA website and talking about the mobile app, everything that's available on the mobile app, but particularly this was talking about certificate of eligibility, being able to access that now, I guess, through the app too, and we can talk exactly what that is and what that enables veterans to do, and just the app in general. How cool is this thing? You use it a lot.
Ding, 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 ding. The mobile app is the newest thing. It's great. It's user-friendly. So for any veterans listening to Service and Sacrifice, know that there is a VA mobile app. It has this big blue square with a VA on it. That's how you know it is. But it's awesome. It's user-friendly. It's got 4 tabs on the bottom: home, health, benefits, payments. This thing is great. You can access prescriptions and order prescriptions off of it, health benefits letters, service connection letters. You can find out where you're at on the service connection, what level of percentage of service connection you are. Are you 30? Are you 70? Are you 80%? Are you 100%? It's great. And then the benefits piece of it too. It tells you if you're going in for a service connection, it tells you what active cases you are, what's been approved. It gives you hindsight on what your payments look like, whether you have been paid or not. The certificate eligibility is on there. And when you download these, it's quick. It takes seconds to download it, and they're right there into your iPhone or your Android. I don't know. I use it a lot just for my appointments. I forget when my appointments are. It tells you where it is, what you're getting seen for. It's just an amazing tool to really help you navigate through your health administration hospital here at the Albany VA, or your service benefits, your service connections, which is a big thing that we talk about here. But it's a wonderful tool.
And it's so you're saying it's well designed, user friendly.
It's so easy. Even Emil.
That was my next question. Do you use it?
I'll be honest with you, I have no apps on my phone.
Okay,
so
all right, fair enough.
Again,
Yet.
I think this is a great thing to get and to look into, and it certainly makes it easier, and I would encourage everybody to do this.
It's so easy. I mean, everything you need in the palm of your hand. You'll never forget when you have this app. And that's the thing, too. It sends you reminders when your appointment is. It'll send you reminders of when your prescriptions are due. It's great. It's cooler than Facebook. So
it's cooler than Facebook. Well, you heard that here. Hey, listen, we've got a big show this week, so I'm gonna cut this a little short off the top here. But joining us next is Jennifer Stiletto Smith. We're gonna get more into, and you'll excuse me, Dom, I'm forgetting Jennifer's exact title at the VA.
She's a licensed clinical social worker, but she's like an outreach. I mean, it's like 1,000-letter title, but she pretty much she focuses on outreach and mental health.
And we're going to be talking more about suicide prevention, and unfortunately, numbers are on the rise for our veterans across the country, and everything that's available to help them. Jennifer's going to answer it all for us. And at the very end of the show, another special guest, Scott Leslie from the Albany County Veterans Services Bureau, will be in to answer a question or two as well. So stay tuned. You're watching Service and Sacrifice here on WTEN Plus. Welcome back to Service and Sacrifice for this Friday, April the 10th. Joining us now is our good friend Jennifer Stiletto Smith. Jennifer joins us from the Stratton VA. Jen, hi, how are you?
I am well. Thank you for having me.
Pleasure to have you here. So why don't you introduce yourself to everybody? Let us know who you are and what you do.
Sure. I am a social worker at the Albany VA. My official title is the Community Engagement and Partnership Coordinator in the Suicide Prevention Program.
Awesome. So this week we're talking about, and it's something we've we've mentioned previously here on Service and Sacrifice, and that is the rate and current rate of suicide for veterans across this country. And unfortunately, it continues to go up. What can you tell me about that?
Well, it's important for people to know that veteran suicide rates remain nearly twice as high as the general population. In 2023, the rates were reported that around 17 veterans a day die by suicide. And while we don't like to put a number on that, it's very important that we acknowledge that even one is too many deaths. And, nationally, it did go down slightly in 2023 from our most recent national report. However, our New York State rates from 2023 that was recently released saw a 20-year high, and it was a 25% increase, with our highest risk population being ages 18 to 34.
What tools, Jen, and screening things are available for you and for others at the VA when dealing with this, when people come to see you?
So all of our veterans annually receive a suicide risk assessment. So that's even if they're not engaged in our mental health treatment, they can receive that evaluation in a primary care appointment, a specialty clinic, the dental clinic, anywhere. And so annually they receive that. And based on their responses, if they are seen to be at an elevated risk, then further assessment is facilitated by a mental health professional. And that opens the doors to get them engaged in, additional care, mental health support, enhanced care and monitoring.
Emil, I'm wondering, as you sit here and you listen to Jennifer and all that is available to help our veterans nowadays. You're a veteran of the Vietnam War. When you and your peers were coming home, was anything like this made available to you? Were you made aware of anything like this support and services that we have today?
I was not aware of anything like this, and it may have existed, but to market it, nobody was doing it. We didn't know we could go anywhere and talk about it, and we just dealt with it as our own personal problems.
Jen, when you hear from, as we mentioned, that the highest rates are among that 18 to 34 category, which would put a lot of those folks in the Iraq and Afghanistan campaigns that have come home most recently. What is the biggest issue you find they talk about? Is it strictly a lot of diagnosis of PTSD? Is it people struggling to find their place back here at home? Is it a combination of both?
Yeah, I would say it's really a combination of both. Before I was in this role, for many years, I was in the clinical suicide prevention team. And, what I found was, a lack of connection, some readjustment issues with these returning veterans. And a lot of times, especially our younger veterans, they don't reach out for help. They don't want to engage because they feel like they can handle it on their own. And a lot of times I'll hear from veterans that they want to save the care for somebody who needs it more than them. There's a big misconception that if they engage in VA care, that they're taking it away from somebody who needs it more. What a lot of people don't know is when you enroll in VA care, there's a lot of funding that even just for an initial primary care appointment goes towards the VA to open the doors for a lot of other veterans who may need the care more. And so a lot of, younger vets may not reach out. And so it's our job to really meet them where they're at and help engage them into care and service.
Emil, I've heard that a lot from you too before about veterans that you've spoken to over the years, that they have that hesitancy to reach out and help themselves.
I think the biggest problem is they don't acknowledge that there is a cure for this, and they think it's just some mental stigma that everybody has because they were in the service and they have to learn to deal with it, and they think everybody has dealt with it themselves, and that's not the case now. It's a completely different problem solution.
How easy is it, Jen, for our vets, especially here in the capital region, to reach out and get the help they need?
Oh, well, honestly, we're a facility that functions like a normal hospital with several specialty clinics. And so what's, also unique to us is we do have an urgent mental health clinic that is embedded in our ER. So, Monday through Friday, if a veteran walks through our doors and is experiencing a mental health crisis or even just mental health needs, they can be seen same day by a clinician, a psychiatrist. And, a lot of times mental health crises doesn't happen Monday through Friday during normal business hours, but that's okay because if they come in the after hours, whether it be in the evening or the weekends, they can also be seen by mental health professionals through the ER, whether it be in person or through telehealth. And so really, if somebody is just in need of help, even if they're not enrolled in VA care and they want, to be seen, they can come in, we can get them connected, right away, and they can be seen in our ER.
Lots more to talk about on this subject in particular. We're going to take a quick break here on Service and Sacrifice. We'll be back in just a minute. Welcome back to Service and Sacrifice. This week we're joined by Jennifer Stiletto Smith from the Stratton VA, and we've been talking about veterans' mental health, suicide rates. Jen, talk to me a little bit about the Compact Act, what it is and what that provides.
Yeah, absolutely. So the Compact Act stands for Veterans Comprehensive Prevention, Access to Care and Treatment. This was implemented in January of 2023. This allows veterans in acute suicidal crisis to receive free, immediate emergency mental health care at any VA or non-VA facility. So this is really important because this applies to a veteran even if they're not actively enrolled and engaged in VA care. So in the past, a lot of times when a veteran would seek treatment outside of the VA, they would receive a bill because they were seeking outside of VA services. However, now VA will provide the funding for that care, even if they choose to receive that emergent mental health care outside of VA. And that covers transportation, emergency room visits for suicidality, up to 30 days of inpatient care, and up to 90 days of outpatient care. And that's regardless of VA enrollment status. So I want to emphasize that they don't have to be enrolled in order to seek emergent mental health care in the community or at VA at no cost to the veteran.
That's fantastic. For people who are at home who have a loved one who is a veteran who may be struggling, those caregivers out there, what is available to them to help them spot some warning signs, if you will?
Yeah, absolutely. So we have our gatekeeper training, which is our VA SAVE training. That's our suicide prevention training, and that's available to loved ones, family members, veterans, and also providers in the community. And that really looks at identifying, risk factors and warning signs. It, talks about how to ask somebody if they're struggling with suicidality, how to validate that person's experience, and how to expedite and, bring that person into care. And we also have caregiver support programs that's available to family members. And of course, there's always the emergent mental health resources like 988. You press 1 if you're a veteran or service member or calling about a veteran or service member, and you can talk to a responder live about the concern. And those referrals go to our suicide prevention program at VA for additional follow-up.
Emily, you often talk about fellow veterans who are not taking advantage of things. What do you have to say to them?
I tell them that the things that they may be experiencing right now that we did in my generation and other generations. And then I explain that they will actually help the VA and help the funding of the VA by signing up and taking advantage of it. And when they go down there, all of a sudden they're amongst others just like themselves. And that's a great feeling. And that brings some relief to a lot of feelings when you walk in there. So I encourage them and say I did the same thing. If I didn't go to the VA for 40 years after I got out of the Army and regret it, but I thought I was doing something good, and I just realized I was doing the wrong thing and I needed to go.
Yeah. And Jen, for those who aren't taking advantage, who aren't using VA healthcare, what sort of outreach is being done to reach them?
Well, we have a lot of different programs that do outreach in the community. So suicide prevention, we attend as many suicide prevention related events that we can. And also our business office does a lot of different outreach for enrollment, claims clinics. You can even find Albany VA staff at the Balloon Fest up in Warren, Washington County, at the different county fairs. Anywhere there may be a veteran or a service member or a loved one that may be looking to get, a veteran connected or extra support. It doesn't have to be a veteran-specific event. So, if folks would like VA to be involved and provide information, provide, different tools, we can come out to the community and support in any way. And it doesn't have to be a veteran-specific event. It can be anything.
How do you know, Jen, what kind of tools are used to know how effective what you're doing is being?
Yeah, that's a good question. We work very closely with our veterans, and when we are, assessing for suicidality and providing things like a safety plan. A lot of times we want to work with a veteran when they're not in an active crisis, right, to develop a safety plan so that they can use those tools to remain safe. Because the thing that I always tell people is when you're in a suicidal crisis, it's kind of like a horse with blinders on. You can't see what's around you. You can't see the support. You're only focused on that crisis, on that issue at hand. And so working with our veterans, yes, in a time of crisis, but also in a time when things are going well, to help develop those safety nets, those supports, and what we can do to be helpful in those moments, and really just have those tools readily available, whether it's the veteran themselves, their loved one, or the provider, partnering with their next of kin and their loved ones to really be able to build in those supports for when they need them most.
And to wrap up, when somebody is in that emergency, that 988 number is available to everybody. They can press what number then to get directly to veteran supports in particular, right? There's a...
Yeah, 988 and then press 1 if you're
1.
a veteran or service member calling about a veteran or service member. Yep.
And we encourage everybody, if they're not taking advantage of VA healthcare yet, to get in and take care of that. And Emil, how easy is it?
There is really no involvement personally that you have to do anything. You can walk into the VA hospital. You can go and just sign up while you're there. You can go to your county office building if you want, and the VSO will help you do it there. You can call the 800 number and set it up with the VA. So, again, a lot of different ways, but you only have to do that once. So please do it.
Get everybody to take advantage. Jen, thanks so much for coming in this week. Jen's going to be back with us next week as well, because there's a lot to talk about when it comes to our veterans' mental health. But for right now, we're going to take a quick break. Back with more here on Service and Sacrifice. Welcome back to Service and Sacrifice here on WTEN Plus. We've come into the final segment here where we say bye-bye, but this is where we also answer questions that we solicit from everybody out there who's watching. And joining us, special guest today for our question segment, Scott Leslie from the Albany County Veterans Bureau. Scott, thanks for coming in. How are you?
Doing well. Thanks for having me today.
Absolutely. Dom said you were the man to answer this question. So this week, our question is, what is the VA's duty to assist, and what should I expect in gathering evidence for a disability claim? What's going on here?
Want to cover the VA side of the house?
Yeah, so it goes hand in hand, right? Service connections are the golden nugget for veterans, right? Everything you fought for, everything you did in the military, you come back with some aches. How do you get recompensated for that? And it's service connections. Now, the VA side of the house, we will provide all the documentation that you need, with the medical documentation, prescriptions. I know in the first segment we went over the VA mobile app. You can get a lot through that mobile app. Yourself and us were enhancing our services. But it really comes down to service connection officers. Now, in previous segments, you've heard me say, veterans can apply for their service connections themselves, but if you're a first time, you're applying for this for the first time, I really recommend going to your county office and looking for the Veteran Service Connection Bureau, and then talk to guys like Scott Leslie. And Scott, what are the biggest things, the evidences that you really need to compile in order to have a successful service connection?
Yeah, Don, a lot of the issues that stem from incomplete or denied applications for compensation are often tied to missing documentation. So what we want to advise our veterans out there, they're best to collect any and all records and documentation that they can find. This includes service treatment records from when you're in the service. This could include work impact statements where a particular issue impacted you in the civilian sector, and it's clearly demonstrated that in your civilian job. You're also encouraged to find prescription records, anything that you can find that might be related. It could be an LOD, line of duty injury report from your time on a deployment. It could also be records that you obtained from a behavioral health specialist. It could be any documentation that's related to that connection. It could also include buddy statements. These are statements where friends or family or fellow veterans and service members, it could be a subordinate, it could be a commanding officer, it could be one of your supervisors in the service.
I was just going to say
They,
that. You know.
yeah, they can provide a buddy statement. They'd say, I state your name, witnessed on this time and date, so-and-so was involved in a workplace accident. And those types of buddy statements will help substantiate a claim for service connection.
Absolutely. I mean, they're witnesses. But it's important to really use the VA, the health administration, and your the guys that really submit these claims for you, the service connection officers, whether they're at your county, whether they're an organization, whether they're at the VA Medical Center. It's important to work together in coalition to get these services provided for the veterans. And it's really hard to speak on this as a veteran. I'm a service-connected veteran. I mean, all three of us are service-connected veterans. It's really hard to do it by yourself. So I always recommend to everyone, find your nearest service connection officer, whether they're at the county, at the VA, whether an organization, and really sit down with them and go over what you've been through, try to figure out the navigational piece of it. But these guys are out here in your counties, in your backyards. They're here to work for you, to help enhance your services. So it's really important to use gentlemen like Scott Leslie.
And Scott, real quick, let me get you to explain what are some of the things that you may offer that they're not going to find at the VA Medical Center? What can they find through the county that may be different that they can take advantage of?
Experience. In one word,
experience.
Our service officers in the office have years of experience filing claims with the VA. They understand the process. They understand the paperwork. We have a lot of tricks up our sleeve where we can help obtain documents to substantiate the claim, support the veteran. And there's also other opportunities for services and events that they'll learn about through my office or through other county offices.
And Ryan, I think that's important because we just talked to Jen with suicide awareness. It's important. The events that he's talking about that Albany County does, like the yoga and all those other events, those are events that were created to help veterans fuse back to civilian life, to meet other veterans, to socialize, to network. Those are things that our veterans need when they're coming back home. These are the type of atmospheres they need to get involved in. So I really appreciate everything you guys do in Albany County for our veterans.
Don. Yeah, with all these events, one of the biggest issues we see with our warriors that are coming back home is they're missing out on that social connection. They're dealing with isolation. They came back from, let's say they just did 4 years in the Army or the Marine Corps. They came from an environment where people lived values on a day-to-day basis where they treated each other with respect, and they come back to the civilian life and you can barely hold down a conversation with somebody that's in the service industry or just really we talk about our veterans having a trouble adapting to civilian life, but really the problem is we as a society need to do better to try and adapt
to them,
to their level. We need to try and meet our veterans where they're at, not the other way around. But Don,
Scott,
thanks for that.
Great information. Thank you for coming in today. Thank you for watching Service and Sacrifice this week here on WTN Plus. Remember, get those questions in. Email me directly, rpeterson@news10.com. We have the guys like this in here with us every week. We will have answers to questions, any questions you may have. If you're a veteran yourself, you're taking care of a veteran in your life. We're back next week here on Service and Sacrifice on WTN Plus. Thanks again.